হ্যালো এভরিওয়ান, প্রত্যেক দিনের মতো আজকেও আমি আপনাদের জন্য কিছু ইম্পর্টেন্ট কোশ্চেন নিয়ে চলে এসেছি। যেহেতু কালকে আমি ভিডিওর মধ্যে অবস্ট্রিক অ্যান্ড গাইনোকোলজিক্যাল নার্সিংয়ের যে কোশ্চেনগুলো রয়েছে সেই কোশ্চেনগুলো নিয়ে আলোচনা করেছিলাম। সে আগের ভিডিওতে বেশ কয়েকটা ইম্পর্টেন্ট কোশ্চেন নিয়ে আলোচনা করেছিলাম এবং আমি সেখানে বলেছিলাম যে আমি আরও ইম্পর্টেন্ট কোশ্চেন নিয়ে আমার নেক্সট ভিডিওতে আলোচনা করব। তো আজকের এই ভিডিওতে টোটাল 100টার মতো অবস্ট্রিক অ্যান্ড গাইনোকোলজিক্যাল নার্সিংয়ের যে কোশ্চেনগুলো রয়েছে সেই কোশ্চেন নিয়ে আলোচনা করব এবং এই কোশ্চেনগুলো থাকবে মাল্টিপল চয়েস কোশ্চেন। তো বেশি দেরি না করে চলো তাড়াতাড়ি ভিডিওটা শুরু করা যাক। অবস্ট্রিক অ্যান্ড গাইনোকোলজিক্যাল নার্সিং, এই অবস্ট্রিক অ্যান্ড গাইনোকোলজিক্যাল নার্সিংয়ের ভেতরেও যেটা আমাদের টপিক রয়েছে, আজকের টপিক কমন গাইনোকোলজিক্যাল ডিসঅর্ডার। তো কমন গাইনোকোলজিক্যাল ডিসঅর্ডারের মধ্যে যে কোশ্চেনগুলো রয়েছে আজকে এই ভিডিওর মধ্যে আমি 100টার মতো কোশ্চেন নিয়ে আলোচনা করব। সো দ্য ফার্স্ট কোশ্চেন ইজ, which of the following option is associated with an increased chance of having breast cancer? Option A, a woman's mother-in-law with a past history of mastectomy. Option B, a woman's abdomen and waist mass increase. Option C, a non-alcoholic and non-smoker woman. And option D, a 35-year-old woman using barrier method of contraception. And the correct answer is option B, a woman's abdomen and waist mass increase. And the next question is, all of the following are the causative organism of urethritis except option A, Taenia solium, option B, Mycoplasma genitalium, option C, Neisseria gonorrhea, option D, Chlamydia trachomatis. And the correct option is option A, Taenia solium. And the next question is, a family planning procedure where aspiration of uterine contents is done within 6 to 14 days of missed period is called option A, menstrual induction, option B, induced abortion, option C, menstrual reduction, and option D, menstrual regulation. And the correct option is option D, menstrual regulation. And the next question in, inspection of the uterine cavity by endoscopy with access through the cervix is known as option A, hysteroscopy, option B, salpingoscopy, option C, salpingogram, and option D, hysterosalpingography. And the correct option is option A, hysteroscopy. And the next question is, the condition where the uterus turns inside out is called option A, uterine inversion, option B, prolapse, option C, anteversion, and option D, retroversion. And the correct option is option A, uterine inversion. And the next question is, the most common genital prolapse is option A, rectocele, option B, cytocele, option C, prosidentia, and option E, introcele. And the correct option is option B, cytocele. And the next question is, which of the following hormone is increased in polycystic ovarian syndrome? Option A, 17-OH progesterone, option B, luteinizing hormone LH, option B, follicle stimulating hormone, and option D, thyroid stimulating hormone. And the correct option is option B, luteinizing hormone. And the next question is, all of the following are common symptoms of perimenopause except option A, irregular periods, option B, increased libido, option C, vaginal dryness, option D, hot flashes. And the correct option is option B, increased libido. কারণ সবগুলো এখানে যেগুলো আছে, ইরেগুলার পিরিয়ডস, ভ্যাজিনাল ড্রাইনেস অ্যান্ড হট ফ্ল্যাশেস, এগুলো যখন মেনোপজ হয় তখন এইগুলো সিমটমসগুলো দেখা যায়। তার জন্য এখানে কারেক্ট অপশনটি হবে অপশন বি, ইনক্রিজড লিবিডো। And the next question is, unicornuate uterus refers to option A, menstruation occurs but is not visible due to an obstruction in the outflow tract. Option B, distension of the vagina caused by accumulation of fluid due to congenital vaginal obstruction. Option C, uterus is formed from only one of the paired Mullerian ducts. And option D, complete duplication of uterine horns as well as duplication of the cervix. And the correct option is option C, uterus is formed from only one of the impaired Mullerian ducts. And the next question is, a type of Mullerian ducts anomaly in which there is complete duplication of uterine horns as well as duplication of the cervix with no communication between them is known as. Option A, unicornuate uterus. Option B, bicornuate uterus. Option C, hyperplasia uterus. And option D, uterus didelphys. And the correct option is option D, uterus didelphys. And the next question is, acquired risk factor for genital prolapse is option A, vaginal delivery with consequent injury to the supporting structures. Option B, congenital weakness of the supporting structures. Option C, malnutrition and aging. Option D, increased weight of the uterus. And the correct option is option A, vaginal delivery with consequent injury to the supporting structures. And the next question is, descent of the uterus toward introitus is known as option A, first degree uterine prolapse. Option B, second degree uterine prolapse. Option C, third degree uterine prolapse. And option D, fifth degree uterine prolapse. And the correct option is option B, second degree uterine prolapse. And the next question is, the degree of uterine prolapse in which the uterine body descends to lie outside the introitus is option A, first degree. Option B, second degree. Option C, third degree. And option D, fourth degree. And the correct option is option C, third degree. And the next question is, genital prolapse manifestation includes all except option A, difficulty in passing urine. Option B, backache. Option C, difficulty in passing stool. And option D, chancroid. And the correct option is option D, chancroid. And the next question is, what is the cause of primary cervical dystocia? Option A, rigid cervix. Option B, inefficient uterine contraction. Option C, first birth in which external OS fails to dilate. And option D, all of the above. And the correct option is option D, all of the above. And the next question is, what is the cause of secondary cervical dystocia? Option A, scarring of the cervix. Option B, post-delivery. Option C, post-operative scarring. And option D, all of these. And the correct option is option D, all of these. And the next question is, cervical incontinence result in option A, second trimester miscarriage. Option B, third trimester miscarriage. Option C, recurrent abortion preterm labor. Option D, all of the above. And the correct option is option D, all of the above. And the next question is, cephalopelvic disproportion can be assessed with the help of option A, Chasser-Morris method, option B, Menero-Kerr method, option C, left hand grip, and option D, all of this. And the correct option is option D, all of this. And the next question is, a 40-year-old woman was advised estrogen replacement therapy by the gynecologist. The nurse was directed to educate the woman about the estrogen replacement therapy. Which of the following statement by the nurse indicates that the nurse is aware of the possible complication of estrogen therapy? Option A, estrogen promotes diuresis and weight loss, so increase your fluid intake. Option B, you will feel discomfort due to estrogen, so take an analgesic period to estrogen. And option C, to avoid constipation, you need to increase roughage in your diet. And option D, make sure you keep your clinic appointment, especially your gynecologic checkup. And the correct option is option D, make sure you keep your clinic appointment, especially your gynecologic checkup. And the next question is, semi-follower position is recommended in pelvic inflammatory disease for option A, easy observation, option B, promoting drainage to prevent abscess, option C, faster healing, and option D, more comfort for the patient. And the correct option is option B, promoting drainage to prevent abscess. And the next question is, which of the following condition may be caused by a gonococcal infection? Option A, Bartholin cyst, option B, infertility, option C, pelvic inflammatory disease, option D, all of the above. And the correct option is option D, all of the above. And the next question is, most common hernia in females is option A, femoral hernia, option B, inguinal hernia, option C, Spigelian hernia, and option D, obturator hernia. And the correct option is option B, inguinal hernia. And the next question is, which of these is not a symptom of vaginal atrophy? Option A, tightening of vaginal wall, option B, lengthening of vaginal canal, option C, decreased vaginal lubrication, and option D, urinary incontinence. And the correct option is option B, lengthening of vaginal canal. And the next question is, what is the common cause of constipation during pregnancy? Option A, lack of fluid intake, option B, decreased fiber intake, and option C, reduced intestinal mobility, and option D, lack of activity. And the correct option is option C, reduced intestinal mobility. And the next question is, which of the following instructions should nurse give to a client who is 26 weeks pregnant and complains of constipation? Option A, encourage her to increase her intake and roughage and to drink at least 6 glasses of water per day. Option B, tell her to go to the evaluation unit because constipation may be cause contraction. Option C, tell her to ask her caregiver for a mild laxative. And option D, suggest the use of an over-the-counter stool softener. And the correct option is option A, encourage her to increase her intake of roughage and to drink at least 6 glasses of water per day. And the next question is, A primigravida client at 25 weeks gestation visits a clinic and tells the nurse that her lower back aches when she arrives home from work. The nurse should suggest that the client perform option A, leg lifting, option B, tailor sitting, option C, side laying, and option D, squatting exercise. And the correct option is option B, tailor sitting. And the next question is pregnant woman who is 4 months pregnant asks the nurse how much and what type of exercise she should get during pregnancy. How should nurse counsel her? Option A, exercise to raise the heart rate above 140 beats per minute for 20 minutes daily. Option B, perform gentle back line exercise for 30 minutes daily. Option C, try high intensity aerobics but limit session to 15 minutes daily. Option D, work briskly for 10 to 15 minutes daily and gradually increase this time. And the correct option is option D, work briskly for 10 to 15 minutes daily and gradually increase this time. And the next question is, which of the following is not advised for a pregnant woman with a complaint of varicose vein? Option A, wear support stockings. Option B, stand for long periods. Option C, exercise the calf muscles. And option D, elevate legs when sitting. And the correct option is option B, stand for long periods. And the next question is, in pregnancy, diagnosis of appendicitis will be late because option A, vomiting may many misinterpret and hyperemesis. Option B, ESR and WBC count will be elevated in normal pregnancy as well as appendicitis. Option C, location of pain will be shifted to a higher level and may misdiagnosed as cholelithiasis or renal infection. Option D, all of the above. And the correct option is option D, all of the above. And the next question is, supine hypotensive syndrome is more commonly seen during option A, first trimester, option B, second trimester, option C, third trimester, and option D, whole antenatal period. And the correct option is option C, third trimester. And the next question is, stillbirth rate includes babies' death after option A, 20 weeks, option B, 24 weeks, option C, 28 weeks, and option D, 32 weeks. And the correct option is option D, 32 weeks. And the next question is, a 38-week pregnant mother is complaining of discomfort due to irregularly occurring contraction. The best advice by the nurse is option A, lie down in supine position, option B, take some warm drinks, option C, walk around, and option D, take some analgesics. And the correct option is option C, walk around. And the next question is, full form of HELLP is option A, hemolysis, elevated liver enzymes and low platelet level. Option B, hematuria, elevated leukocytes and low prothrombin time. And option C, hematuria, elevated leukocytes and low parietal thromboplastin time. Option B, hematuria, elevated leukocytes and low platelet level. And the correct option is option A, hemolysis, elevated liver enzymes and low platelet level. And the next question is, pseudocyesis is option A, false belief of a woman that she is pregnant. Option B, abnormal enlargement of uterus. Option C, false diagnosis that a person is pregnant. Option D, all of the above. And the correct option is option A, false belief of a woman that she is pregnant. And the next question is, all of the following are recognized cause of uterine growth retardation except option A, hypertension, option B, smoking, option C, hypercholesterolemia, and option D, diabetes. And the right option is option C, hypercholesterolemia. And the next question is, during delivery, the risk of transmission of maternal infection to the fetus is highest in option A, rubella, option B, cytomegalovirus, option C, herpes simplex virus, and option D, human papillomavirus. And the correct option is option C, herpes simplex virus. And the next question is, which one among the following indicates postpartum depression? Option A, suicidal thoughts. Option B, desire to harm the infant. Option C, feeling of worthlessness, and option D, all of this. And the correct option is option D, all of this. And the next question is, aerobic organism responsible for puerperal sepsis is option A, bacteroides, option B, Klebsiella, option C, Clostridium welchi, and option D, Clostridium. And the correct option is option B, Klebsiella. And the next question is, the condition where the uterus turns inside out is known as option A, retroversion, option B, prolapse, option C, introversion, and option D, inversion. And the correct option is option D, inversion. And the next question is, Mr. X, a postnatal mother, is admitted with history of fever of 102 degrees Fahrenheit, abdominal pain, and foul-smelling lochia on 8th postnatal day. Which of the following complication does this indicate? Option A, puerperal sepsis, option B, peritonitis, option C, perineal tear, and option D, subinvolution. And the correct option is option A, puerperal sepsis. And the next question is, infection of genital tract due to complication of delivery is termed option A, puerperal sepsis, option B, cervical infection, option C, peritoneal sepsis, and option D, vaginal infection. And the correct option is option A, puerperal sepsis. And the next question is, Pilkmesia alba dolens is found in option A, breast complication, option B, deep vein thrombosis, option C, placenta previa, and option D, pulmonary embolism. And the correct option is option B, deep vein thrombosis. And the next question is, chance of acute endometritis are more after option A, menopause, option B, menarche, option C, abortion or childbirth, option D, infection. And the correct option is option C, abortion or childbirth. And the next question is, pallor, bradycardia, sweating, nausea, hypotension, dizziness occur when a pregnant woman lies on her back, and this is known as option A, malignant hypothermia, option B, orthostatic hypotension, option C, respiratory distress syndrome, and option D, supine hypotensive syndrome. And the correct option is option D, supine hypotensive syndrome. And the next question is, Nurse caring for a high-risk pregnant lady with heart disease must know which one of the following valvular lesion cause death during labor. Option A, aortic stenosis. Option B, aortic regurgitation. Option C, mitral stenosis. And option D, mitral regurgitation. And the correct option is option C, mitral stenosis. And the next question is, vulval cancer can be due to option A, fungal infection. Option B, bacterial infection. Option C, HPV infection. And option D, all of this. And the correct option is option C, HPV infection. And the next question is, which of the following Which of the following is the treatment of choice for most benign ovarian tumor? Option A, allowing the tumor for a spontaneous resolution. Option B, chemotherapy. Option C, radiation therapy. Option D, surgical removal. And the correct option is option D, surgical removal. And the next question is, the most common type of ovarian cancer is option A, adenocarcinomas. Option B, endometrial tumors. Option C, epithelial ovarian cancer. Option D, mucous adenocarcinomas. And the correct option is option C, epithelial ovarian cancer. And the next question is, commonest benign solid tumors in female is option A, fibroid tumors. Option B, endometriosis. Option C, cancer of uterus. And option D, cervical cancer. And the correct option is option A, fibroid tumors. And the next question is, fibroid tumors is more common in option A, nulliparous women. Option B, postmenopausal women. Option C, women with multiple sexual partners. Option D, after 35 years of age. And the correct option is option A, nulliparous women. And the next question is, clinical manifestation of fibroid uterus include option A, heavy periods. Option B, severe abdominal pain. Option C, both A and B. Option D, none of these. And the correct answer is option C, both A and B. And the next question is, complication associated with uterine fibroid is option A, persistent menorrhagia leading to anemia. Option B, menstrual pain. Option C, abdominal cramps. And option D, all of the above. And the correct option is option D, all of the above. And the next question is, changes that occur to the uterus in uterine fibroid are option A, increased surface area of the endometrium. Option B, interference with normal uterine contractility. Option C, pelvic congestion. And option D, all of the above. And the correct option is option D, all of the above. And the next question is, cause behind infertility in fibroid uterus is option A, ovum production is not there. Option B, sperm are malformed. Option C, fibroid uterus prevent rhythmic uterine contraction during intercourse. Option D, none of the above. And the correct option is option C, fibroid uterus prevent rhythmic uterine contraction during intercourse. And the next question is, normal lining of the uterus grows inside the uterus is known as option A, cancer of cervix, option B, endometriosis, option C, adenoma of uterus, and option D, fibroid uterus. And the correct option is option B, endometriosis. And the next question is, common site of endometriosis include option A, ovary, option B, fallopian tube, option C, intestine, and option D, all of this. And the correct option is option D, all of this. And the next question is, the most common treatment modality for vaginal cancer is option A, chemotherapy, option B, radiotherapy, option C, surgery, and option D, complementary therapy. And the correct answer is option C, surgery. And the next question is, the benign growth in the muscles fibers of the uterus is called option A, myoma, option B, cyst, option C, congenital abnormality, and option D, uterine prolapse. And the correct option is option A, myoma. And the next question is, among the following, which of the following age group women are most vulnerable for vulvar cancer? Option A, 45 to 60 years, option B, 60 to 70 years, option C, 70 to 80 years, and option D, above 80 years. And the correct option is option B, 60 to 70 years. And the next question is, tingling, numbness, and pain in the thumb and fingers of a pregnant woman is suggestive of which condition? Option A, osteoporosis, option B, rheumatoid arthritis, option C, carpal tunnel syndrome, and option D, calcium deficiency. And the correct option is option C, carpal tunnel syndrome. And the next question is, MMR is option A, maternal death per 1 lakh live births, option B, maternal death per 10,000 live births, option C, maternal death per 1,000 live births, and option D, maternal death per 100 live births. And the correct option is option A, maternal death per 1 lakh live births. And the next question is, which of the following sign in a client indicates thrombophlebitis? Option A, orthostatic hypotension, option B, shortness of breath when climbing stairs, option C, diarrhea, option D, a painful swelling usually in one leg. And the correct option is option D, a painful swelling usually in one leg. Next question, which of the following clinical manifestations suggest the presence of vulvovaginal candidiasis? Option A, mucoid discharge and redness, option B, multiple ulcerative lesion with pruritus, option C, greenish yellow discharge and pruritus, option D, cardi discharge, most reddened skin and pruritus. And the correct option is option D, cardi discharge, moist reddened skin and pruritus. And the next question is, traits are passed on from parents to their offspring by option A, genes, option B, chromosomes, option C, hormones, option D, enzymes. And the correct option is option A, genes. And the next question is, what is the fertility test that requires a couple to have sexual intercourse at the time of ovulation and come for testing 2 to 8 hours after intercourse? Option A, Horner test, option B, semen analysis, option C, endometrial biopsy, and option D, hysterosalpingogram. And the correct option is option A, Horner test. And the next question is the incidence of previous caesarean scare ruptured is 0.5%, option B 0.5 to 1.0%, option C 1 to 2%, and option D 2 to 3%. And the correct option is option A 0.5%. And the next question is in which of the following condition does liquor enter the maternal circulation, causing sudden hypotension, hypoxia, dyspnea, and often seizures? Option A, amniotic fluid embolism, option B, pulmonary embolism, option C, obstetric shock, and option D, uterine atony. And the correct option is option A, amniotic fluid embolism. And the next question is commonest cause of vesicovaginal fistula is option A, hysterectomy, option B, vaginal delivery, option C, abdominal surgery, and option D, vaginal tuberculosis. And the correct option is option B, vaginal delivery. And the next question is correction of vesicovaginal fistula done at option A, during menstruation, option B, 5th day of menstruation, option C, 3 to 6 months following delivery, and option D, after menopause. And the correct option is option C, 3 to 6 months following delivery. And the next question is the commonest cause of uterovaginal fistula is option A, vaginal tuberculosis, option B, trauma during pelvic surgery, option C, cancer of cervix, and option D, hormonal therapy. And the correct option is option B, trauma during pelvic surgery. And the next question is a postpartum patient was in labor for 32 hours and had ruptured membranes for 24 hours. Which of the following conditions is expected in this client? Option A, endometriosis, option B, endometritis, option C, pelvic thrombophlebitis, option D, salpingitis. And the correct option is option B, endometritis. And the next question is state of abnormal uterine bleeding without any clinically detectable organic pelvic pathology and that is due to changes in hormone level is known as option A, menorrhagia, option B, metrorrhagia, option C, dysfunctional uterine bleeding, and option D, epimenorrhea. And the correct option is option C, dysfunctional uterine bleeding. And the next question is as a management of dysfunctional uterine bleeding, endometrial resection is done in option A, age over 35, option B, completed her family, option C, not has any significant endometrial pathology such as cancer, and option D, all of the above. And the right option is option D, all of the above. And the next question is which gland is responsible for initiating the menstrual cycle? Option A, hypothalamus, option B, anterior pituitary gland, option B, posterior pituitary gland, and option D, ovaries. And the correct option is option A, hypothalamus. And the next question is the entire transitional phase between sexual maturity and menopause is called option A, menarche, option B, puberty, option C, telarch, option C, climacteric. And the correct answer is option D, climacteric. And the next question is, a 14-year-old girl come to the gynecologist with her mother because she has not attained menarche. She has a history of unknown cancer at the age of 10 and had received chemotherapy. What may be the cause for the given scenario? Option A, autoimmune ovarian failure. Option B, irradiation. Option C, etoposide. Option D, iatrogenic. And the correct option is option C, etoposide. And the next question is, hormone responsible for telarch is option A, estrogen. Option B, progesterone. Option C, oxytocin. And option D, androgens. And the correct option is option A, estrogen. And the next question is, a permanent cessation of menstruation at the end of reproductive life is called option A, menarche. Option B, menopause. Option C, precocious puberty. And option D, telarch. And the correct option is option B, menopause. And the next question is, hormonal changes that occur in menopause are all except fall in serum estradiol level. Option B, increase in FSH level. Option C, increase in LH level. And option D, fall in serum testosterone level. And the correct option is option D, fall in serum testosterone level. And the next question is, identify the changes occur in female genitalia after menopause. Option A, uterus becomes smaller. Option B, the vagina becomes narrower and dry. Option C, ovary become small in size. And option D, all of the above. And the correct option is option D, all of the above. And the next question is, after menopause in women, the chances of a developing osteoporosis increase because of option A, decrease in estrogen level. Option B, increase in estrogen level. Option C, decrease in LH levels. And option D, decrease in FSH level. And the correct option is option A, decrease in estrogen level. And the next question is, delay menopause is option A, menopause fails to occur beyond 45 years of age. Option B, menopause fails to occur beyond 50 years of age. Option C, menopause fails to occur beyond 55 years of age. Option D, menopause fails to occur beyond 60 years of age. And the correct answer is option C, menopause fails to occur beyond 55 years of age. And the next question is, which of the following is not true about premenstrual syndrome? Option A, it occurs during the last half of menstrual cycle. Option B, it resolves with the onset of menstruation. Option C, it occurs during the luteal phase. And option D, it resolves with the onset of ovulation. And the correct answer is option D, it resolved with the onset of ovulation. And the next question is, mild premenstrual syndrome can be treated with option A, anxiolytics. Option B, dietary advice, exercise and evening primrose oil. And option C, vitamins and mineral supplement. And option D, antidepressants. And the correct option is option B, dietary advice, exercise and evening primrose oil. And the next question is, primary dysmenorrhea is caused by option A, narrowing of the cervical canal, option B, uterine hypoplasia and contraction, option C, increased vasopressin release, and option D, all of the above. And the correct option is option D, all of the above. And the next question is, bleeding between menstrual period is known as option A, menorrhagia, option B, metrorrhagia, option C, polymenorrhea, and option D, dysmenorrhea. And the correct option is option B, metrorrhagia. And the next question is, absence of the menstrual period in women of reproductive age is known as option A, hypomenorrhea, option B, amenorrhea, option C, dysmenorrhea, and option D, eumenorrhea. And the correct option is option B, amenorrhea. And the correct option is option B, amenorrhea. And the next question is, short of scanty periods that last for greater than 2 days is known as option A, amenorrhea, option B, hypomenorrhea, option C, menorrhagia, and option D, metrorrhagia. And the correct option is option B, hypomenorrhea. And the next question is, too frequent menstruation occurring at any time, but particularly at the beginning and end of menstrual life is known as option A, metrorrhagia, option B, hypomenorrhea, option C, hypermenorrhea, option D, epimenorrhea. And the correct option is option D, epimenorrhea. And the next question is, increased uterine blood flow occurring at regular intervals or loss of greater than 80 ml of blood is called option A, epimenorrhea, option B, hypermenorrhea, option C, cryptomenorrhea, and option D, metrorrhagia. And the correct option is option B, hypermenorrhea. And the next question is, epimenorrhea is also known as option A, menorrhagia, option B, polymenorrhea, option C, metrorrhagia, and option D, dysmenorrhea. And the correct option is option B, polymenorrhea. And the next question is, abnormally heavy bleeding as menstruation is known as option A, menorrhagia, option B, metrorrhagia, option C, polymenorrhea, and option D, dysmenorrhea. And the correct option is option A, menorrhagia. And the next question is, menorrhagia is caused by option A, fibroid uterus, option B, adenomyosis, option C, dysfunctional uterine bleeding, and option D, all of the above. And the correct option is option D, all of the above. And the next question is, a condition in which prolonged or excessive uterine bleeding occur irregularly and more frequently than normal is known as option A, menorrhagia, option B, metrorrhagia, option C, menometrorrhagia, and option D, epimenorrhea. And the correct option is option C, menometrorrhea. And the next question is, hypomenorrhea is caused by option A, endometrial tuberculosis, option B, malnutrition, option C, uterine synechiae, and option D, all of the above. And the correct option is option D, all of the above. Next question is, dysmenorrhea is due to option A, ovulation, option B, decreased progesterone, option C, increased progesterone, and option D, secretory epithelium. And the correct option is option B, decreased progesterone. And the next question is, a specific manifestation of menopause is option A, hot flashes, option B, hypotension, option C, hypothermia, option D, anorexia. And the correct option is option A, hot flashes. And the next question is, a condition in which menstruation occurs but is not visible because of an obstruction of the outflow tract is known as option A, cryptomenorrhea, option B, dysmenorrhea, option C, serocolpos, and option D, menorrhea. And the correct option is option A, cryptomenorrhea. And the next question is, distension of the vagina caused by accumulation of fluid due to congenital vaginal obstruction is known as option A, hydrovaginitis, option B, hydrocolpos, option C, hydrovaginosis, and option D, vaginismus. And the correct option is option D, hydrocolpos. And the next question is, commonest cause of cryptomenorrhea is option A, rectovaginal fistula, option B, imperforate hymen, option C, adhesion, and option D, cervical stenosis. And the correct option is option B, imperforate hymen. তো আজকের এই ভিডিওর মধ্যে আমি অবস্ট্রিক অ্যান্ড গাইনোকোলজিক্যাল নার্সিংয়ের যে কোশ্চেনগুলো রয়েছে এই কোশ্চেনগুলো নিয়ে আলোচনা করলাম। তো এই ভিডিওর মধ্যে আজকে 100টার মতো কোশ্চেন নিয়ে আলোচনা করেছি। আরও কোশ্চেন নিয়ে আমি আলোচনা করব আমার নেক্সট ভিডিওতে। তো আজকের মতো এইটুকু, দেখা হচ্ছে আমার পরের ভিডিওতে।